We started out self-help coming out of that Iowa ag background that we are. And so we are very connected to the Ministry of Food and Agriculture. And we are committed and have been all these years in working with farmers, and more than 70 or 80% of the women in these villages, that's what they do. They are farmers. They work the land, and we help them to grow crops that have more nutritional value for their families. We help them grow vegetable gardens in the dry season. When we hear dry season in Ghana, that is hunger season. When the rains come, this is land that blooms, that's green. There's all kinds of things that women can harvest from what we would call the ditches to put in their soups. And they do. The very big significance of all of this is the importance of the first 1,000 days as far as the children that are conceived and born in that village. How they are nourished in the womb up until 2 years of age. It determines the growth as far as their bodies are concerned, if they will reach their height potential, and that also relates to the growth of their little brains. And so it means that if they are malnourished during those first 1,000 days, that child will be less able to learn when they go to school. And when they hit the workforce, they will be less productive than they would be if they had not been stunted and malnourished within their early years. And actually, economists can measure that in populations. When your stunting rates start edging over 20%, 25%, you can watch the drop in the GDP of that country. And so, for the whole potential of the community, it has great consequences going forward. If that woman is not fed during her pregnancy, she cannot meet her protein needs. If she cannot meet the vitamins and the minerals, we start with that first one that's so important, and that's iron. Iron is most available from animal protein sources. For example, if I could give those pregnant women 4 hard-boiled eggs a week, I would meet so many of their needs as far as iron, zinc, protein, excellent fats, beta-carotene, the whole panoply with a complete protein that they could absolutely need. In the Ashanti region, where we knew that the indigenous chickens were being affected, our ag people have gone in, they've inoculated them. I've asked about, are there indigenous chickens just running around in the upper west? No, they've all been knocked out by some poultry diseases. So we need to get our ag people up there to figure out what it is, so that at least we've got some indigenous poultry running around. And we're working with obtaining the kinds of seeds and slips that would grow up in that region. And so we've got some ideas of how to get some growing done within their dry season, because otherwise climate change is going to decimate those villages. People will not be able to live there because there will not be enough to get them through. I will tell you that this is the most challenging period that self-help has faced in Ghana since I've been on the board back in 2006. what has happened in the whole world in these last 2.5 years, we really are only coming to understand what has hit us. This newest report from an international scale on nutrition and children and women that's been put out by UNICEF is titled Fed to Fail. In other words, just what we've been talking about. As climate change has changed things, they were very poor before, and now they're even at another level. They can no longer afford millet. So that is why we can say that as we look at the world's children, particularly in sub-Saharan Africa, all across it, we are looking at levels of famine and malnutrition that we've never seen. We have data that goes back a number of years across all kinds of interventions in developing countries, all around the world. And they all tell us the same kind of thing, that you have to increase the purchasing power of women if you are going to impact the nutritional status of their children. When we can set up women with even small, what would look to us like petty trading little businesses, but that gives them some money that then they can make food choices for themselves, for their children. They will obviously always make those choices for their children before they will feed themselves. So they get some choice about what they get to plant. They're working in the fields, what they get to plant, what they get to cultivate, what they get to harvest, what they get to feed to their families. For those in little businesses, we teach them some financial skills for managing that money and for making better choices. It does work. When the women have access to the financial means to be able to make those choices, when they have access to the foods to be able to make those choices, you can see, and research shows that and has consistently for years and years, that then you can improve the nutritional status. The nurses came to us, and to have nurses alarmed about those nutritional kinds of things, then I, as a nutritionist, know if they're alarmed, I know that I would be horrified. At the level of hemoglobin that they are saying for a cutoff that their women are okay, in a prenatal clinic in the US, you would be saying, oh my gosh, we've got a real problem here. So again, it's just, it's what they're seeing and what we're seeing. And then if that woman cannot, because she's nutritionally does not have the reserves to be able to produce the milk of the quantity and the quality needed for that new baby, then we come through that period with that brain and nervous system less well developed than it has the genetic potential to be. And then in the next phase, when we move to weaning, if we are not able to supply those foods that would be of sufficient nutritional value so that that baby can grow and not end up stunted and malnourished. So we've got lots of places that we need to intervene. Some of it rather right now on an emergency standpoint. That's going to take some of what we can do, but we will do those emergency kinds of things framed in a long-term approach. Keep working with these communities. And that's what we're asking you to do, to help us do that. Let's do it.